Most common opportunistic yeast isolated from bloodstream infections in ICU, Candida albicans. Germ tube test positive within 2 hours in serum indicates which Candida species, Candida albicans. Fluconazole-resistant yeast that forms pseudohyphae but negative germ tube, Candida krusei, and C. auris, germ tube negative. Sabouraud dextrose agar has a low pH of 2 to inhibit bacterial growth, 5.6. India ink preparation demonstrates encapsulated budding yeast of Cryptococcus neoformans. Cryptococcal antigen detection in CSF is performed by which rapid assay? Latex agglutination or lateral flow immunoassay. Erd droppings are an environmental source of which encapsulated yeast? Cryptococcus neoformans. Mucormycosis risk is highest in patients with ketoacidosis due to inability of phagocytes to bind pathogen with low pH. Serum, tissue pH acidic. Broad aseptate hyphae branching at right angles are characteristic of which order of fungi? Mucorales, e.g., Rhizopus. Drug of choice for rhinocerebral mucormycosis? Liposomal amphotericin B. Voriconazole is ineffective against mucorales because target enzyme has intrinsic low affinity to azole, CYP51A1. Acute angle 45-degree dichotomous branching septate hyphae indicates infection by Aspergillus species. Fungus ball aspergilloma most commonly forms in cavities left by which disease? Healed pulmonary tuberculosis. Galactomannan antigen ELISA is useful in early diagnosis of invasive aspergillosis. The azole preferred in invasive aspergillosis as first line as per IDSA 2020, voriconazole. Dermatophyte classification. Microsporum infects skin and hair but not nails. Most common dermatophyte causing Tinea corporis in India, 2024 trend. Trichophyton mentagrophytes interdigitale complex. Wood lap fluoresces bright green in infection with which dermatophyte of scalp? Microsporum canis autoenii, any fluorescing species. DOC for extensive Tinea corporis unresponsive to topical azoles, oral terbinafine 250 mg daily. Terbinafine inhibits fungal enzyme, squalene epoxidase. Griseofulvin acts by interfering with fungal quasi-spore formation. Microtubule mitotic spindle. Itraconazole pore absorption is improved by administering with juice. Acidic beverage, orange cola. Dimorphic fungus causing desert valley fever endemic to southwest USA. Coccidioides immitis passataceae. Histoplasma capsulate in mold phase shows macroconidia with walls, tuberculate spiny thick walls. Blastomyces dermatitidis yeast exhibits budding, broad-based. Spaghetti and meatballs appearance in KOH mount indicates which superficial mycosis? Nalacesia furfur pityriasis versicolor. Chromoblastomycosis lesions show sclerotic bodies, also called bodies. Medlar, copper penny bodies. Doc for chromoblastomycosis small lesion beside surgery, itraconazole. Rose Gardner's disease is caused by dimorphic fungus, Sporothrix schenckii. Sporothrix schenckii in tissue appears as cells, cigar-shaped budding yeast. Mycetoma grains that are black are usually produced by which group of fungi? Eumycetoma, Motorella mycetomatis. Eumycetoma DOC is prolonged therapy with antifungal, itraconazole. Penicillium marnefae talarameces infection is AIDS-defining in this region, Southeast Asia. Penicillium marnefae yeast divides by fission. Transverse binary fission, sausage-shaped sectate yeast. Cryptococcus gattii predominantly affects immunocompetent and is associated with which tree species? Eucalyptus camaldulensis. Potassium hydroxide concentration used for hair nail KOH mount is 10%, 10-20%, 20% for nail. Pneumocystis jirovecii pneumonia radiograph typically shows bilateral infiltrates, perihilar interstitial/ground glass. Doc for pneumocystis jirovecii pneumonia with PaO2 less than 70 mm of Hg, trimethoprim sulfonmethoxazole plus steroids. Azole antifungals target which step of ergosterol biosynthesis? 14-alpha-demethylation of lanosterol. Echinocandins inhibit synthesis of glucan in fungal cell wall. 1,3-beta-D-glucan. Amphotericin B binds to ergosterol, forming, in the cell membrane, pores, channels. Flucytosine acts synergistically with amphotericin B in cryptococcal meningitis by inhibiting XB synthesis. Fungal DNA RNA converted to 5-FU. Endemic mycosis with pilot wheel multiple budding yeast is Paracoccidioides brasiliensis. Lactophenol cotton blue mount of Aspergillus fumigatus shows phyalides arranged, one phase, uniseriately covering upper 2/3 of vesicle. Aspergillus niger conidial heads are characteristically black-colored. Rhodotorulum mucilaginosa colonies produce characteristic pigment of what color? Pink to coral red. Fungus causing automycosis most commonly, Aspergillus niger. Dermatophyte arthroconidia inside hair shaft describe a type of Tinea capitis, endothrix. Favus type of Tinea capitis is caused by which species? Trichophyton schonlanii. Hair perforation test positive helps differentiate Trichophyton mentagrophytes, positive, from negative, Trichophyton rubrum. Yeast most commonly colonizing catheters and forms biofilms resistant to azoles, Candida parasitosis. Emerging multi-drug-resistant nosocomial yeast that grows at 42 degrees Celsius and requires MALDI-TOF identification, Candida auris. Doc for C. auris invasive infection per CDC. Echinocandin, e.g. caspofungin. Onychomycosis due to non-dermatophyte mold scopulariopsis is often resistant to terbinafine and azoles poor response. ECG therapy for bladder cancer may rarely cause disseminated infection with fungus-like yeast. Mycobacterium bovis BCG, not fungus, variant, but fungal not relevant, skip. Serum beta-D-glucan assay is not useful for diagnosis of which fungal infection? Mucormycosis, low glucan content. Coccidioides skin test becomes positive after infection, indicating immunity. Cell-mediated, delayed. Doc for sporotrichosis lymphocutaneous type besides itraconazole. Saturated potassium iodide oral solution. Cladosporium carrioni causes chromoblastomycosis with slow progression prevalent in which Indian region? Subtropical arid regions, e.g., Rajasthan. The Setiobolus ranarum infection produces subcutaneous mass with Splendor-Hopley phenomenon and eosinophilia. Doc, itraconazole or potassium iodide. Serology with double immunodiffusion detecting antibodies against A and H antigens is used in sexual mycosis. Histoplasmosis. Black pearl colonies on Sabarad auger refer to which dematiaceous fungus? Fonseca pedrosoe. Fungal keratitis, most common worldwide culprit? Fusarium species. Natamycin 5% eye drops are DOC for keratitis due to filamentous fungi, Fusarium, aspergillus. Malassezia growth in vitro requires supplementation of medium with white olive oil/lithids. Piedraia hortae causes black piedra affecting hair, scalp hair, shaft. White piedra is caused by Trichosporin asahi showing arthroconidia, blastoconidia, and arthroconidia around hair. KOH mount of Pneumocystis durevecii shows cysts stained by which fluorochrome stain? Calcifluor white or Gomori methenamine silver? DOC for invasive fusariosis, liposomal amphotericin B or voriconazole. Candida score, amount, suggests early empirical antifungal in ICU, 2.5. CSF opening pressure greater than 25 cm H2O warrants repeated lumbar puncture in meningitis, cryptococcal. Serum creatinine rise during amphotericin therapy is mitigated by using serum formulation, liposomal lipid complex. Dermatophyte test median shows red color due to alkaline metabolites produced by S species, dermatophytes, e.g. trichophyton. Doc for terbinafine-resistant dermatophyte infections now prevalent in India, itraconazole pulse therapy. Endemic mycosis mimicking tuberculosis with adrenal involvement is histoplasmosis. Blastomycosis diagnosis gold standard is culture on Sabarad agar at Sabarad C, 25 to 30 degrees C for mold phase. Chromogenic agar can differentiate Candida albicans, green, from C. cruce, pink, and C. glabrata, mauve, based on enzyme beta-glucosaminidase, species-specific enzyme reactions. Fluconazole prophylaxis in HIV is recommended when CD4 count according to a CD4 count cells to prevent cryptococcosis, not recommended routinely, primary prophylaxis not advised. Trick. In fungal blood cultures, lysis centrifugation method improves recovery of which filamentous mold, aspergillosis species. Mycelial phase of histoplasma appears as hyaline hyphae with large, thick-walled conidia. Macro, tuberculate conidia. In allergic bronchopulmonary aspergillosis, serum IgE level typically exceeds Rays IU per milliliter, plus 1,000 IE per milliliter. Doc for ABPA besides steroids is oral, itraconazole or voriconazole. Scedosporium apiospermum infection is distinguished from aspergillus by resistance to drug class, amphotericin B. Rhinosporidiosis presents nasal polypoidal lesions loaded with sporangia of S. Rhinosporidium seabury, now Mesomycetozoa. Doc for cutaneous rhinosporidiosis lesions after surgery, dapsone 100 mg daily. KOH mount with Parker Inc. shows thick-walled, non-budding spherical sporangia of Rhinosporidium seabury. Histoplasma antigen detection in urine is especially useful in which patient group? HIV-infected disseminated histoplasmosis. Dermatophyte infection recalcitrance in India is partly due to mutation in squalene epoxidase gene, conferring resistance to terbinafine. Jock itch refers to Tinea cruris. Doc for Tinea capitis inflammatory, carrion type in children, oral grisofulvin. Mold phase of Paracoccidioides shows multiple budding resembling pilot wheel at X degrees Celsius. 37 degrees Celsius, yeast phase but multiple budding. Serology false positives in histoplasma antigen test may occur with infection of which fungus? Blastomyces dermatitidis. Epidemic of mucormycosis in COVID-19 was linked to uncontrolled diabetes mellitus and corticosteroid use. First Indian liposomal amphotericin B brand approved for mucormycosis is Ambisome Gilead or Lysofungin, except. Doc for cerebral aspergillosis per latest guidelines, voriconazole high dose plus or minus surgery. Hair shaft fluorescence under wood lamp due to pteridin produced by which dermatophyte? Microsporum species. Fungal endocarditis most commonly caused by which Candida species? Candida parapsilosis. mycetoma triad, tumefaction, multiple sinuses, and discharge of grains, colonies of organism. Stains such as Grocott methenamine silver highlight fungal cell walls by reducing silver to color, black. DOC for invasive candidiasis in neonates weighing less than 1,500 grams, Lysomolamphoterasin B.